Are we good? Okay. Okay. Before I introduce myself, I'd like to inform all of you that we are recording this presentation and will share the video on our school district website. Good evening and welcome to the Coping with COVID Supporting Mental Health and Safety in a Pandemic Winter Community Forum. My name is Brenda Weiss and I am a health education and physical education teacher here at Coney Middle High School. This pandemic winter has been difficult for many individuals. It has been challenging for our children learning remotely and struggling with the mandated social isolation. It has been challenging for parents and caregivers balancing the need to work, caring for their children, and living with the uncertainty and threats of COVID-19. And it has been challenging for my colleagues and I as we navigate and care for our students in an effort to provide them with the best possible education under the circumstances. And speaking of students, I'd like to turn over the mic to one Coney student in particular who has been involved in organizing the forum and spreading the word to staff, students, and the Augusta community. Eli?
Good evening, everyone. My name is Elijah, and I'm a senior at Coney. I got involved in this because I have aspirations to be a social worker after high school, and particularly working with people who are dealing with crises and who are really struggling. And so I've had the honor to be able to help spread this word through our school and the greater Augusta area, hopefully get as many people this very valuable information as possible. I hope you all enjoy the presentation.
For almost everyone, our mental health and sense of hope suffers as we balance safety and access to the supports we need. Tonight's presentation acknowledges the challenging times we are living through and will offer guidance to address mental wellness. Several NAMI and Coney staff will be introducing themselves, or Augusta staff will be introducing themselves along with providing school and community resources. These resources will be offered along with the opportunity to share your concerns and ideas throughout tonight's presentation on how to get through the remaining school year and into the future. Tonight's presentation is being co-sponsored by the Maine Suicide Prevention Program, the Augusta School Department, and NAMI Maine. A quick shout out of gratitude to the Augusta School Department Administration and particularly Kim Silsby, Coney's principal, for the positive support in hosting this important forum. It is now my pleasure to introduce tonight's speaker. Greg Marley is a licensed clinical social worker, as well as the clinical director for NAMI Maine, the National Alliance on Mental Illness. I've had the fortune of attending various NAMI trainings and workshops under Greg's guidance and expertise. I hope you enjoy the program.
All right, thank you very much, Brenda. And thanks to everybody who really contributed to the planning of this. All these things are always best done when there's a group of us. And speaking of a group of us, we've got 35, 40 people here in the room. And I invite you at any time to type your comments or your suggestions or your questions into the chat box. And at the bottom of your screen where it says reactions, there's a place where you can raise your hand. And even if I'm in the middle of saying something and you have a question, feel free to raise your hand and we will try and get to that. There'll be times I'm going to be breaking and and allowing that to happen, and times when, let's go back, when we'll just let you do that on your own. I'm also want to let you know that I'm going to be doing a series of quick poll questions as we go on. And each poll is going to be self-explanatory when it comes up. They're all anonymous. So you can feel free to answer the way you would choose to. It's not going to come back at you in any way individually. That allows people to be as clear as you would like on them. And you'll see it when I'll tell you a little bit more when I launch the first one. And really what I want to know is who's here and what's going on in your life. Because this is really, it's a forum about our health and our needs as we deal with the time of this pandemic. Um, so with that, I'm going to go ahead and share my screen. As we get toward the end of the presentation, there's going to be a time when some of the community providers beyond Augusta Schools Department and NAMI Maine are going to talk about the resources we have in this community to kind of support families, to support students as we cope with COVID. So I'm going to go ahead and share my screen. And we will move on from there. And I want to appreciate also the folks that are taking part tonight in terms of monitoring the chat and letting people in. Thanks to Amanda and Kim and folks, and we'll get through this. I want to acknowledge that the funding for much of what I do in suicide prevention in the state comes under the umbrella of the Maine Suicide Prevention Program, which is part of the Maine Center for Disease Control and Prevention. And it's been around and active in the state since the mid-1990s. We do a great, NAMI has the contract to provide the training and the technical assistance for that program. And as Brenda says, we do a wide range of training, a lot for school staff, for healthcare people, for law enforcement, for veteran serving groups, just about anybody who's likely to work with someone at higher risk for suicide. So don't hesitate to reach out for that. We also provide a lot of consultation and technical assistance to help folks develop protocols, to help people who are dealing with potential risk for suicide and how they manage that to get the help they need, and also do support and guidance in the aftermath of suicide losses. And this year, all of that seems to be even more important than before. And I know we're going to hear from Crystal Thiring later today. We're taking part as a state in a Garrett Lee Smith federal grant that's addressing youth suicide, which has really helped us to expand some of the programming we're offering through schools and youth serving organizations. And about 3 of us on the call here work for NAMI Maine. And just be aware that NAMI's out there as a grassroots organization supporting folks whose lives are touched by mental health needs. And realistically, I always believe that's just about every one of us. Because if it's not me, or someone in my family, or extended family, or my neighbors, or my coworkers, you know, so many of us. And we do that in a lot of ways. And we'll talk a little bit about those at the end of the day. So off we go. And I want to acknowledge that in this time, seeking balance has never been more important. And in that, I want to acknowledge that this is what we're talking about today. We're going to acknowledge the stresses of this pandemic on our health, our mental health, our functioning, as well as some ways through it. And I'm going to launch the first poll as we do that. And I just want you to kind of let me know where you fit in terms of our audience. Are you a student? Are you a parent of a student? Are you a community professional? And we'll go on from there. So fill out where you fit, and I think you probably can choose more than one because some of us are more than one of those categories. I'm a community professional. I'm a parent. So take a few minutes to do that, and then I'll immediately show you who's in the room. That's what I love about these Zoom polls. They're immediate feedback, and we all need immediate feedback today. All right, so most people have voted. So give just another minute, and then I'm going to show you what's here. All right, I'm going to close the poll and show you. So we've got a lot of school professionals from the area school. We've got community members, we've got youth and parents and other community professionals. So pretty diverse audience. I don't know who the others are. You can tell me if you'd like in the chat. All right, so I'm going to stop sharing that and we'll move on. Um, so I want to start out right now just saying for all of us, thinking back a year when we first saw this pandemic starting, it was first called a potential pandemic, and it started to come into our country in Washington state and then New York. And all of a sudden, about mid-March, we all got shut down. And it felt really sudden. It felt really out of control. And since then, it's dominated our lives. And what we know is this virus does pose a threat to life, a threat to safety. And trying to cope with it has impacted us all, our daily functioning, our access to care, our access to each other, and it's forced us into physical isolation. And that has resulted in social isolation. So how do we connect with others? And I think it's important to share that even now, the United States has the highest impact of COVID anywhere in the country. So tell me, particularly if you're an adult in the room, but even if you're a youth, how has this COVID impacted you? And this is the second poll. Your financial stability, have you lost or someone in your family lost work? Your sense of connection with other people, emotional, mental health, your physical health, the sense of safety that you feel in your community, the sense of hope that you have for the future, and any difficulty in getting the help that I need. So this just, again, it's a snapshot to show that we're all in the middle of this. Some of us impacted more than others. So I'll give you just another minute to finish that. And then I'm going to share those results quickly with you. And one of the challenges with this pandemic has been, since the beginning, is we have been unable to agree on an approach, on a definition, on who's infected and how to manage it. And that, I think, is what has led significantly to the fact that we have the highest numbers. So almost everybody here, 90%, have acknowledged disruptions of social connectedness. 70% emotional or mental health, a quarter physical health, more than half of you, 6 out of 10, my sense of hope has been impacted. Less so financial stability or difficulty getting the help I need. This is probably a pretty good group for that. So one of the things that early on we needed to start doing is to acknowledge how this has impacted us, acknowledge our feelings, and acknowledge what we're going through. This is a marquee up in Dover Foxcroft that in way back last May posted this. It says, stay wicked pod, because that's what everyone was telling us to do at that point. And they posted it later. They started using this marquee, allowing families in the community to post a message for their senior in high school who was graduating, as a way of remarking that, because one of the losses we've had during this time is a loss of those little milestones and marking those milestones, the rituals in our lives. And so everybody's been impacted. And you see that in this first poll, and you'll see it more in the next one. Everybody's impacted by this. And I love this cartoon. He says, at least having anxiety made me feel special. Now everybody has it. And that's one of the things we're going to acknowledge. What has been the impact on this, the mental health impact of this pandemic? So what about you? What has impacted your life in terms of this poll? And I'm going to, in terms of this pandemic. So I'm going to kind of launch this poll, and I'm going to talk to you while you fill it out. Has it impacted your physical health? Several months into the pandemic, I started calling it, the weight issues, the COVID-19. Because at that point, people were doing a lot of stress baking and a lot of stress eating, and we started packing on the pounds. But more than that, people have been impacted by disrupted sleep. To me, sleep is my barometer. It's how I know how much stress I'm feeling, how insecure. If I'm having trouble falling asleep, or even more so, if I wake up with my mind already racing, 1:30, 2 o'clock, 2:30 in the morning, then I know it's a sign. Um, you're, have you had COVID illness? Has someone in your life had COVID illness? What about our emotional health? And we'll talk about where we've seen in young people the increases in depression, anxiety, um, sense of helplessness, disrupted sleep, and even suicidality. So I'm going to share this poll just to kind of to let everybody see kind of where you are all kind of acknowledging you've been. So 65% disrupted sleep, about the same, really high level of stress, about 44 out of 10 feeling depressed, almost half of us, that anxiety, that uncontrolled worrying, and about half of us overeating or disturbed eating. Less so alcohol use, less so just that general white knuckling. And this is pretty common when I've given these. Pretty common. So recognize where we're going. We work a lot with adolescents in this state, and we know already our kids struggle with a certain amount of anxiety, a certain amount of depression. And this is really increased. In fact, our base rate of depression in this country is maybe between 9 and 10%. And now we're looking at maybe about 20%, and I'll show you some data in a minute. Anxiety, anybody who's had a little bit of anxiety, this is really pushed that up over the edge. And it's driven by that uncertainty, by the unsureness of how this is impacting us. Substance use, as evidenced by people's self-report, as evidenced by alcohol sales, other sales, substance use is up across the board. So for those people, and these are the ones I'm really worried about, the people living alone, they're living alone and they're isolating, sometimes even against what they want to do. And that isolation begins to feel like a prison. I hear that about our elders. I hear that also a lot about single parents with children who are trying to work from home and function from home and support their kids from home. So each step is more challenging. So I want to share, this is some data, and these are busy slides, so I'm going to talk you through it. I've been using these two slides as kind of a stand-in for what's going on with our high school and middle school kids, because we don't have good survey results for our youngsters. We do have them for adults because they're easier to get the permission to survey. And this came from a rolling series of surveys that are done by the United States Center for Disease Control. And this one ended toward the end of October. And let me work you through it. So on this left-hand side of the screen, it says, 0.2, 0.4, 0.6, 0.8. That's 20%, 40%, 60%, 80%. And we're looking at anxiety, moderate depression, mild depression, disturbed sleep, and suicidal ideation. That's thoughts of suicide. And so at the end of October, and this is for young adults, 18 through 24, about 4 out of every 10, fairly similar on each of these between women and men. 4 out of 10 said, I'm struggling with anxiety. About the same amount struggling with moderate depression, and almost between 70 and 80% with mild depression. And about 70 to 80% struggling with disturbed sleep. And this one is the part that scares me. Just under 40% of both women and men in that age range talked about feeling suicidal ideation, thinking about suicide. High school levels, our base rate for high school in 2019 was at about 16%, which I already think is high. And now we're up quite a bit higher. And we find that this is also true and just about the same for, at least in this age range, The blue here is those who are in college or some college education, and the orange is those without college, and almost the exact same between the two. We've worried in the past more about how our non-college bound students are functioning. But what I'm also hearing is that here, almost everybody is, whether you're in college or not. And those who are in college are accustomed to getting more support and more help. And now they're doing virtual, they're not in college, they're trying to navigate classes and home. It's more challenging. What are you guys seeing in your young people? So share it in the chat, raise your hand if you want to talk. Feel free, share what you're seeing. Katie says the worry about how family members are coping with the impact. Yeah. And so I come from a background, I was a hospice volunteer and trained in hospice and used to lead grief groups. And so I often think about losses and grief, and that's what we have all been struggling with. The multiple losses that have been happening for this pandemic are things we've all had to struggle with. And I love this image of Robin Williams. He says, everyone you meet is fighting a battle you know nothing about. Be kind, always. Always. So the phases that we go through in when we've had losses were kind of developed by a woman 52 years ago, Elizabeth Kubler-Ross. And she started to talk about the phases of grief. And initially she says there's shock. There's that disbelief that this is really happening. I'm not accepting it. And underneath that slightly can be denial, pushing it away, and even magical thinking. Do you know people who've been stuck in denial about this pandemic, stuck in magical thinking? Because remember, you can get stuck in almost any place. And underneath that shock and denial is the pain, the uncertainty, the distress, the pain of the losses we're feeling, the pain of disconnection, and sometimes a great deal of anger. And where does that anger get expressed? Where does the anger get pointed? And some people have been stuck in anger, and others bargaining. I started bargaining early on. If I only did this, if I do this, I can get through it. You know, if I just wear a mask, I can do anything I want, those kinds of things. And then underneath that, depression. And at what point did you start feeling the depression of this? For me, it was in April. I started getting tired of this, and it just seemed to go too long. And that's a long time ago. Depression, anxiety, and then waves of acceptance. And I saw it in people around me as they accept what they need to do, accepted ways of dealing with this, because from acceptance came innovation. Do you remember when you first started doing Zoom dinners and Zoom connections with people? When you figured out how you could meet people outdoors safely? Yeah. And because the losses keep coming, the cycle keeps going over and over again. So I'm noticing some things in the chat. Patty says, my concern isn't too much about the students we see as much as for the remote students we're losing contact with. We're going to talk about that in a bit. Yeah. Worried about disconnection, sleeping a lot. And Jenny says, I'm seeing more younger elementary children expressing suicidal ideation this year than in the past 2 years. Yeah. Also, siblings of teens experiencing stress with their older brother or sister openly suicidal. So there's some strong stuff in there. I appreciate you sharing it. So from that place of acceptance comes innovation and developing coping strategies. And I want to underscore and talk about the coping strategies that you're using and that other people are using. And here we have Superman figuring out how he can cope. And she says, you know, aren't you going to do something to fight this coronavirus? And he says, I am doing it. I'm staying home. And sometimes, you know, staying home is great, but we can't live our lives at home. So what do we do beyond that? Um, so I'm going to ask you about your self-care suggestions in a poll, to what you find valuable. What are the top ones you use? While we're also talking about um, the typical range of self-care. So what many people found out, if they were suddenly working from home, they, got a week into it, 2 weeks into it, and they realized they were still in those same sweatpants. They haven't established a routine. And so, maintaining a routine, establishing a routine, and kind of, I call them rules. I get up in the morning, I shave whether I'm working or not, whether I have a presentation or not. And I'm not always perfect on that. Um, and I figure out a routine for my day: work, exercise, cooking, doing the dishes, house projects, garden projects, and figuring out that balance that we've all had to do between work and home, particularly if you're doing work while at home and the home is around you. How many people here have found yourself, if you're working from home, it's harder to leave work at the end of the day? Another routine that I find has gotten really important for us all is maintaining good sleep and getting good sleep hygiene in place. Keep calm, keep cooking. What grounds you? Music, meditation, all those things. Um, and one of the things that I find from many people I talk to is the outdoors. Many of us have nature right out our back door, and it's so easy to get into. And it's an easy thing to do with social distancing. Though I noticed early on there were some trails that got closed down because they were getting too crowded. So I had to go further afield. Walk, bike, skate, snowshoe, hike. Moving snow is exercise. Um, and, all the things that keep us calmer. Meditation. I love calming music, journaling, prayer, whatever works for you, particularly as this winter seems like it's going longer. So I'm sharing the results on this one. Um, and and this has been pretty classic on all the times I've done these polls. 3/4 of us, or 2/3 of us, say getting out in nature. That's what works for me. When alone, finding my walking buddy, whatever works. Exercise of any kind is just beneath that, more than half. Connecting with family and friends, and we'll talk maybe about that at the end, doing that with more intentionality. Um, Reading, other than the news, distracting movies, games, series, and I'm amazed that's only 30% of people are escaping into movies or series. About the same, listening or playing music. Not so many writers here. That's okay. So lots of ways of coping. And we learned, and some of those things we've learned, we've had to do more of. And if there's any others that you particularly like, put it in the thing. Um, I know for me, I started baking sourdough bread this year. And I'm sure there's other people on this who've done that as well. I'm home. I can take the time to do it. It works. And what I hear over and over, starting with school staff way back in April, end of March, is the challenge of staying connected virtually. The challenge with staying connected, as someone says, with their students who seem to be drifting away. So how do you do it in your personal life? How do we do it in professional life? In my personal life, maintaining contact with a core pod. I have a 26-year-old son, and he's developed a pod of people that he does some socializing with. And they're all kind of talking about how they're maintaining safety so they can trust one another. And if one of them has been out doing things that are not safe, is okay, we're not going to see you for 10 days. How do you harness the internet to your needs? And how are your kids doing that? How many people here never Zoomed before February? And how many people here are Zooming now 3 or 4 or 5 times a day? Yeah. These are things I've also heard, keeping it simple. Grandparents who have spent this time, and they'll get books, and they'll get a copy of the book, and they'll send a copy to their grandchild or grandchildren, and they'll read those books together every night. And it gives the parents a break, and it gives the grandparents a connection to their grandchildren. Same thing with watching a movie together. My son, and he'd be embarrassed if I told you this, he's courting somebody. And they haven't seen each other in several years, but they're sharing movies, they're reading books together, they're having meals together, all virtually. She's down in Connecticut. Virtual book clubs, virtual exercise classes, virtual dinners, particularly now that winter has set in again. What works for you? I know that old ritual Dungeons and Dragons in people's lives has come back. My son, the other generation, is doing that with a group of people. These are the rituals. These are the little things that keep us together and also make our life having meaning. And as this marathon continues into an ultra marathon, they become even more important. So House says, I think it's even more difficult in Central Maine to stay connected versus living in a city. Yeah, particularly socially connected. I think you're totally right, Patty. Sending messages through simple text to people just to say something positive. Yeah, there's so many little ways we can send that. Everything that typically brings joy is dangerous now. Too many of them. Yeah. So what are the red flags as we deal with this stress? What are the red flags in you? And then we're going to talk about what are the red flags in your students, whether they're your child, whether you're working in a school. Watch for that disrupted sleep, someone who's not able to get enough sleep. I was hearing that from some school staff just the other day. He says, I'm dealing with middle school students who say they're getting 2 to 3 hours a night because they're up with their devices in the middle of the night. That racing mind, that unproductive worry, particularly if it develops into panic attacks. How many of you are having intrusive anxiety thoughts, even intrusive anxiety dreams? It's another sign of that. I worry about people who, even in the midst of this, are avoiding folks, isolating, not answering texts, avoiding families and friends especially. Uncontrolled emotion, whether that be anger, tears, that deep sadness, is really important to keep your eye on. And I come from a family where my father was an alcoholic. So I'm always kind of conscious of alcohol use or substance use. So watch that in your life. Make sure that it's not getting in control of you and out of your control. And high-risk behaviors. And I think some of the blowing off COVID restrictions is a little bit about, for some people, about high risk. And that's a red flag for me. And always think about those people who may be stuck in blame. And are there other red flags that you worry about for the people in your life? Yeah, so in the title, it says we have skills and tools. My elderly mother is not skilled to have the tools to do virtual. Yeah, and this can be a major assumption. I agree. It's a major assumption for people to assume that. I have a 90-year-old mom, and we tried to get her online for a long time, and she said, no, I'm just not going to do it. I don't want to do it. And so there's other elders who do it really well. My mother's not one of them. And so I'm calling her more often than I would have. Yeah, typically. And fortunately, I think my other siblings are as well. So what about our students? What are they facing in this, and how are you seeing it in your students, whether it's your child or not? And I'm going to launch a poll for how your students are adapting to education in a minute as well. But what's it like for them? Are they able to physically get connected to the school environment? Is it a connection that is stable, or does it come and go? What about their mental health and their sense of hope? I worry about that. And also their ability to connect with the world beyond school, friends, activities, professional supports. Are they set up in their home? I know some people live in small apartments with children and they only have one central room, and that's where the internet access is. Do they have a place that's set up to do school work or not? And then can they get the basic needs met? Particularly if they have family members who've lost work. Do they have adequate food, shelter? All are the things that I hear from a lot of people in terms of the concerns about their students. So I've launched this poll, and this is more, it's for students. And so I know we don't have very many, but the school staff here asked me to put that in. I was hoping we'd have more. So it looks like they've done it. So all of them can reliably connect. No one has a quiet, separate place for schoolwork. And no one needs to or has set an alarm. 1 out of 3, my parents assist. 1 out of 3, I'm able to communicate with my teacher as well. We'll have to think about what that says about our students here. So what are the red flags? And what are the red flags for you, whether you're a parent in the community? What I worry about, and I started seeing it and talking to school staff about it in the spring, I call them AWOL. Those students that seem to be absent without leave, that are kind of drifting apart or drifting away. They're not engaged. They may not be completing tasks, assignments, particularly those students who normally need a lot of hands-on help. Or have they slipped away? Always the heightened anxiety and mood. Red flag for me in students are those that are avoiding their friends, avoiding school, dropping out of clubs or things that they've been involved with. And some of those that are slipping away are engaging more in substance use. They're escaping things in that way. Uncontrolled anger, uncontrolled tears, uncontrolled panic, the same way with adults. And I worry those kids that are slipping away, what does that mean about their hope for the future? So I'm going to stop here because we have a lot of adults in the room. So you tell me, I'm going to stop sharing my slide. Tell me in the chat, tell me online, what are you seeing in your students, your kids, that you're worried about? And how are how are we addressing it? This is where I get to go quiet. And if you're a parent out there with a child who's not in primary school, but in college or college age, answer as well. What are you seeing that worries you about our children? So increased anxiety, lack of motivation, hopelessness, apathy, lack of motivation, definitely increase in anxiety and depression. That's what we're seeing in anger. Lisa says anger. Yeah. And sometimes those who are not able to well articulate the jumble of emotions they're feeling will turn to anger as a way of expressing something. Feeling helpless, feeling defeated, fearing isolation, social and economic dislocation. Yeah. Anxiety, lack of skill to help themselves out of an unhealthy situation. So how do we reach them? And that's where we're going to go next. And I'd love to hear ideas on that as well. And one of the ways is, do our kids, do they have the knowledge base, the awareness of how to connect with help? Because that's what we want to talk about toward the end of this, is how do we engage help? All right, let me do that piece then. Everybody seeing the slideshow again? Someone nod yes, because sometimes I get lost in this. So everyone has an idea. Every one of us have developed ways where we can hack this time, where we can get creative. And then we always have choices around it. So this cartoon I like, he says, you know, how will you respond to this pandemic? Is it denial? Is it panic? Or do you develop a plan? And he says, Alex, I'll take planning for $500, you know, that game show. And what are you doing? And how can you support people to be more planful and less reactive? So what are the hacks you have found that work for you? The Zoom connections? How many people here For you or for the youths in your life, have you supported and developed those hobbies? I noticed my young son is taking up more hiking. He did more camping over the summer, things that he can get out and do. Um, I dove into some of the hobbies that keep me occupied. Um, Figuring out how to get what we need, whether online shopping or dawn shopping runs, particularly if you're particularly vulnerable for the pandemic, to the COVID. Working from home, which has been a lifesaver for me delivering things, and yet it has its own challenges. Taking advantage of nature, the outdoors, that's a big one. That's how I come back to peace. My gardens, being out, walking in the woods, mushrooming when the right time of year. And I think one of the things that has been challenged, and how do we do it well, is how do you both social distance in the same home if you have a family there and you're trying to work. And that one I'm going to talk as a workaround and also a place of stress, particularly for parents working with school age or preschool age children from home. Um, Growing, baking, foraging your own. And one of the things that I have found and seen that is really important for people to figure out how to do is, how do we give back? I first recognized that in this COVID time when my wife and I were diagnosed with COVID illness back in very end of March, early April. We never got tested at that point. You couldn't find a test for love or money. And she works in healthcare. But our doctor was following us, and at that point was following about 10 people she had diagnosed with COVID. And we got really quiet. We were already working from home. We're already socially isolated. But other than my work, I wasn't telling people. And then I put a little thing in a Facebook post, some photographs of our kittens saying, enjoying our new cats while we cope with COVID. And people started reaching in. It made me realize that people were actually reading those things I put out occasionally in posts. And then, someone delivered a pot of soup. Other people delivered bread or flowers or chocolate or cake or cookies. And I was initially embarrassed because I don't easily accept things. But I realized I was giving my neighbors and my friends something to focus on outside themselves, some way of giving back. And that is a lifesaver, something to focus on outside of ourselves. And how do we do that, not only for us, but also for the kids in our lives, the students, the young adults, to allow them a way of giving back? Let me tell you a story. My son has continued to works from home, gets a decent job, gets decent pay. Actually, since he's spending less money, he's saving money. And when the COVID relief package was released, the end of, early winter, he said, "Dad, I don't need this $600. I want to figure out somewhere else I can put it to use in the world." And that's him giving back, something that he can do. And I think we all have that way of doing that. That face mask you saw wearing in an earlier slide, it was made by the folks, the Marshalls around the corner. She's an incredible seamstress. And she started making masks. And her neighbor next door, Eileen, started making masks. And they're still making masks. Very personalized, very well constructed. It's something they could do. Think about it, because that's what builds resilience. And that's where we need to go with this. How do we support resilience in the people around us and in ourselves? And resilience is that ability to bounce back when we're under stress. I like it even more defined as being able to be flexible under stress, to be adaptable. And today in our world, being adaptable is something that's needed. So areas of resilience are really important. And how do we support that in people around us? I love this image I found. It's from the New York Times, and to me, it's kind of like the mycelium, the roots that hold us to the earth and to hold us to our support system. And those roots are physical fitness for resilience, or interpersonal fitness, emotional fitness, our thinking, our cognitive fitness, behavior, our behavioral fitness, and spiritual. And let's kind of talk about what those mean and how we can support those in the people in our lives and ourselves, of course. Um, so for physical fitness, part of that is movement. What keeps us moving? Shoveling snow, climbing stairs, taking a walk, more formal exercise. Because good fitness, good exercise manages stress. It also is a wonderful way of helping to manage anxiety, depression, and it's also a way to connect with others. Got neighbors here who walk every day, and when I can, I may walk with them as a way we can stay socially distanced, but still connected. It also supports our good functioning, cognitively as well. I like, someone said, Jeff says, I have students who started businesses, started exercising, picked up new hobbies, becoming more confident in themselves. Yeah. So how do they do that? It's not just grades. JMG Kids did a food and clothing drive for the Home for Little Wanderers. Valentine's cards for veterans. Again, how to give back. So important. Even the quiet kids spoke up, shared ideas, got involved. Brenda, to add to Brenda, some students appreciate the smaller class size and work well from home, and that's really important to acknowledge. Some students are empowered to care for others. Yeah, all those pieces. Oops. Interpersonal, we just talked about some of those. Loneliness is a driver of depression, but how do we connect beyond our family, connect in the community? For both ourselves and for others, it builds that sense of belonging, that sense of connection. It also is an opportunity for our students to help and for people to ask for and accept help. I had an experience today, a good Maine woman, we were supposed to do a training together coming up right away. And I was on a Zoom call with her and she sounded like Bette Midler, that gravelly growl. And I said, what's going on? She said, she has pneumonia. I said, we don't need to do this training right now. We can put it off. And she didn't want to do that. She was reluctant. And later she emailed me. She said, thank you. I needed that. She couldn't give herself permission. So how about emotional fitness? How do we exercise so we can have tolerance for those hard emotions? Engage in coping, nurture hope. For me, it's around gratitude. Focusing on what I need to be grateful for helps me in my emotions because, yeah, this is hard, but I have a good base to work from. How do we support our kids in having the same thought process? Tony says, that's right. More students are taking time to help facilitate the use of the community closet. Good, Teresa. You're going to tell us about the community college closet at some point, aren't you? Because some of us don't know what it is. Feel free to unmute and do that if you like. So in terms of cognitive fitness, go ahead, Teresa, is that you?
Okay. The community closet is a place where we keep basic needs for students across the whole school department. So kids come and get those materials, get what they need and what they want, and off they go.
Perfect.
So we've had many more volunteers this year who have been willing, since they don't have their sports or other activities, to come and help really facilitate the donations and organizing it. So
excellent.
It's been wonderful.
Yeah. So what keeps our mind fit during this period of time? Think about what's going to help for you. But more, I think we want to focus on behavioral fitness, particularly for our kids, but also for ourselves. That routine, that structure, for many people, structure means safety. address any need of sleep hygiene, because sleep is one of the Maslow's very basic hierarchy of needs. And to set goals, goals that are attainable, that you can step by step reach for yourselves, for your kids, and support them to get there. And all those pieces you've talked about, joining, volunteering, participating in, and all of these add to spiritual fitness. That sense of being a part of something larger than myself that buffers these hard times. So focus on our moral compass, our priorities. Spiritual fitness might be your own religious background and involvement, but it can be bigger than that, or as in many other ways, not bigger than that necessarily, because that's huge in some people's lives. The other thing I want to acknowledge and is about resilience. Resilience is about making choices. And I brought in this cartoon because it says a lot about ourselves and sometimes about our kids. It says, today's the day where everything changes. Yesterday, today, tomorrow. And you know, everything never changes, but little things change incrementally. So focus on what we can do within here and the now, and with what's in front of us. And how do we support for our youth the same focus on the steps that are small and attainable in the moment? Because none of us are going to fundamentally change. At least I know, as I got to be an adult, I realized, no way. I can change little things, but it's still me. And would you want people to fundamentally change? Maybe some of you would say that. So students helping students, which is about empowering the kids. Thank you, Teresa. All right. So what are the concrete steps if we're facilitating someone's coping through this? I always start, I'm a social worker, one of those tree hugging types. You start right at the base of Maslow's hierarchy of needs. If they don't have adequate shelter and food and heat, they can't go anywhere. If they're not getting enough sleep, how do they get ahead? Then right above that is connection to people in your life. That support, that being part of something larger. And from that base, you can learn. If you don't have that base in place, are you able to learn? Always, we need to address isolation in whatever ways we can. Early on, my partner and I were worried about some people who were quite older and were very much isolated, afraid to go shopping, and we did shopping with them. And when we brought their groceries, we would sit out on their deck and chat with them outside for a while. How do we do this? How do we do social events in safe numbers, in safe spaces? Masked and gloved if necessary. Be innovative. And think about that for your kids. We've kept them maybe too much in a box. How do we give them choices about how they socialize safely? And always, how do we focus on the need to access the services that people need in their lives? And we're going to talk about that in just a second. And I worry about access to mental health treatment. So let's talk about what are the resources. And this is time I'm going to kind of turn it over to some of the rest of the people, because we all need to know when to ask for help and when to connect people with the help they need, because any of us can get tipped over by the unequal weight of the stresses of this pandemic. So this is what we've got. I'd love to invite folks to talk about, we're going to go in this order: the school department, school resources, statewide crisis tests, I hope is on now, and healthy community capital area, NAMI. Crystal's going to talk about NAMI resources. And is there anybody else? Did we get someone from the Boys and Girls Club? I don't know if we do. Anyway, so I'm going to turn it over, and I'm going to stop the slideshow at this point, and I'm going to let Tony and Michelle talk about school resources, and anybody else is going to join you.
Great. Hey, thanks so much. Good evening, everybody. Greg, thanks so much for coordinating and directing this, and Brenda and Eli for really spearheading this, and Kim's support. So my name is Tony Veet. I am the other social worker at Coney High School and Middle School. Michelle Burns is my colleague and also a social worker here. Really been looking forward to putting this on tonight and connecting with everybody. I really appreciate seeing so many people here that are obviously thinking about what's going on in this process. We've had a couple people have already posted some resources in the chat, and I'd love to make sure people can figure out how to get those later. So scroll through or and grab the link. I'm actually going to post the link for the Augusta schools if people want to track that, and other resources can be sort of linked out of that. One of the things I was thinking about as we pull in these concepts of resources, and Greg was sharing that idea of Maslow's hierarchy, is the idea of what is the resource that is needed. And so that's part of sharing the district link there, that people can then reach out to folks in their individual schools or superintendent's office or wherever, to track down the resource they need. If it's an emergency resource, that's a 911. There's the crisis hotline, and I think we do have our staff from Crisis here tonight, and they'll detail that more. There's also the teen text line. I saw that link go up. So if people want that, I'm happy to share that. We can also find that later too, and I want to make sure people are able to do that. The concept I think I want to share about what's going on in the schools to provide support to students and to staff is really that we are operating as a network, as a web of support. Specifically, I'm part of the guidance department. Michelle and I are part of the guidance department for the student support services, which includes the school resource officer, and Officer Nutter will speak, I think, in a bit, as well as the reintegration specialist, also the truancy officer, Erin Hartill. She's very thoughtful. McKinney-Vento services and special ed. There's all these layers of support for students. I really want to point out the it's almost a no wrong door for students. They can reach out to peers, they can reach out to custodial staff, coaches, teachers, nursing staff, secretaries, the clinical staff or guidance counselors at each school, student organizations, certainly administration. And all of these people will help make those connections. Greg, your point of like asking for help or reaching out, it can be big, and sometimes it's tough to either receive that or to know, yes, I need to bring my team in or to share this with somebody. And so part of what I think we want to do tonight is just encourage that communication, because we can figure it out as we plan. Other things that are available at the school, of course, is medical care through the through the health center, through the nurses available at each school. And of course, food, not only in terms of breakfast and lunch at school, but also some weekend food bags and that kind of thing that we can connect students with if food is necessary for people to get a little support with. I was going to mention the clothing closet, the community closet. Teresa already mentioned that. It's a really dynamic, well-stocked resource for people. And then I did want to mention, I mean, there's a number of community resources we can help folks connect with, whether it's housing, youth services, the Boys and Girls Club. I did reach out to them, but I didn't hear back. They've got a great homeroom program, which is open in the morning, as well as their afternoon program for the Boys and Girls Club. Augusta Food Bank. Encourage people to check in with their primary care provider or medical clinic. Kennebec Behavioral Health, 211, the warm line, information line people can reach out to. So, and one thing we've been using a lot of, actually Michelle and I have been working on this as a project, is sort of sharing information about social emotional learning. And there is a website through Maine DOE, Department of Education, which talks about building an awareness and resilience. This is a project initially initiated separately from COVID, but it's mapped well with COVID. Want to be mindful about how much information we're putting into people, or I'm trying to put into people right now, and we might all be like right here with information. So if we can just let that kind of float on by, that information is there. I'll actually share the link for the DOE site. Let me see if this will work. And I'm happy to share other information, but I want to make sure there's time for everybody else. And if I missed anything, please help me out. Thanks so much. I think you're muted, Greg.
Michelle, you going to add anything? Was it Tony the speaker?
Tony was our speaker. He
Great.
covered things thoroughly. Yeah.
Excellent. Officer Nutter, you want to talk about SRO and law enforcement in this role as a place to get resources?
Yeah, absolutely. Thanks for having me. My name is Desmond Nutter. I'm a police officer with the Augusta Police Department. I'm currently assigned to Coney High School and Middle School as a school resource officer. My role in the school district as SRO is to serve as a liaison for the Augusta PD and for Coney, provide a safe learning environment for the students and staff, investigate any criminal complaints involving the school or reported from the school. And I'm a resource for parents, students, and faculty members at Coney. I'm going to talk a little bit about the role for APD in the community involving mental health. Sorry, some plants in here, there's some fruit flies. Most APD officers are either certified or waiting to become certified in crisis intervention. And we serve right on the front line with crisis intervention, whether it's getting a call through dispatch, someone flagging us down. Our role is to make the person safe or other members safe. That's our first responsibility. And then it's basically just talking with that person or listening. I've done a lot of listening over the years, both in the school and outside in the community. From there, we make referrals to mental health care facilities. Crisis and counseling is a big one. And we utilize our state mental health worker, Greg Smith, who is available to the community Monday through Friday in the evening hours. He'll usually ride with us in a patrol car, but due to COVID, he's here at the PD, but still available if needed. It's kind of tough right now with COVID. I'm used to seeing multiple kids a day come through my office, talking with them in the halls. I probably talk with on a normal day, 10 to 15 kids. Due to COVID, I don't see very many students. I think I had one so far this week. One of the football guys, I'm a coach. I'm on the staff for Coney football. And basically it was a, hey, I haven't seen you in a while, catching up, how are you, sort of thing. I think the big question from parents, students, and members of the community is, how can they access me? Due to COVID, you can't just come face to face, or we're kind of getting away from that. But the best way is through email, which I'm going to put in the chat. I'll put my extension too. I love talking in person, so COVID's really tough for me. But yeah, any questions, feel free anytime. I have an open door policy at the school, so relay that to your kiddos there. And again, thanks for having me.
So Officer Nutter, before you leave, I'm wondering if there was one of those students who seems to be slipping off the radar and not connecting back into school after someone tries to get them, are you able to go out and knock on their door and say, hey, we're worried about you?
Yes, absolutely. And I have been doing that. I'm going to be doing that more. Right now, we have not a set policy, but it's more like a guideline or suggestion. If you can make a phone call, just to be safe about it, due to COVID, to do so. But if the situation dictates a home visit is necessary, then yes, absolutely, I will be knocking on doors. And yeah.
Excellent, thank you. So you mentioned the regional crisis team, and we have Tess McCoy here from Crisis and Counseling to talk about their services and how to access them in this pandemic. Thank you, Tess, for coming in.
Absolutely. Thanks for having me. And I apologize. I promise I'm not a ghost, but apparently the lighting in my kitchen works differently at night. Um, so I'm really thrilled to be here. I want to share a couple of screens with folks. I know I'm a very visual learner. And so one of them is just kind of an explanation of what the range of crisis services are. And this definitely, this isn't exclusively crisis and counseling. We certainly rely on APD and other police departments who are really doing a lot of frontlines work, especially during the time of COVID, as well as emergency services. But I think folks are pretty clear about when 911 is the appropriate number to call. But I wanted to kind of offer up the crisis hotline and just encourage, if there's any part of you that's wondering, I wonder if this is a crisis situation, please give us a call, and please encourage others to do that. Definitely youth can call themselves, parents can call, and so that's 24/7. And that could lead to kind of phone support. It could refer to referrals to other services. And a lot of what we do through the crisis hotline is really evaluation for the most appropriate level of care. And so generally we go at 3 different options. One of them is referring back to community providers. So doctors, school providers, the folks that they know on a long-term basis. The next level, the middle level, is something called a crisis stabilization unit, which is a short-term stay residential, where folks are supervised 24/7. The goal is kind of to develop coping skills. If there's any medication changes to monitor, we can do that, and connecting to providers. So the CSU is a really great option for either. We certainly have a kids unit in Kennebec County, as well as adult units. And then the third level of care would be inpatient. And so that may be if it's beyond the scope really of the other levels of care. One of the other areas that we are able to provide is a program called Outreach. And so this is able to follow folks post-crisis for up to 30 days, just to make sure, even after they're out of that really acute window where they may need more support, that they are connected then to those long-term providers, that they have access to resources, things like food, things like mean care or free care through the hospitals. So I guess I want to pause there, and Greg, I'm hoping you might be able to help me because I am not multitasky enough to also be looking at the chat to see if anybody has any questions about just generally crisis services. And then I'm hoping I can talk about our Youth Navigator program briefly.
People can also unmute and ask their question live if they choose to. Go into the Family Navigator, I think.
Sounds great. So we
I also
are.
put this on into the chat as well, so they'll be able to get it when you're finished. Yeah.
Thank you very much, Greg. Really appreciate it. So I am very excited to announce this new program that's funded through the state. Crisis and Counseling covers Region 2, which is basically the 9 counties in the middle of the state, certainly including Kennebec and Augusta. And this is a program that is really about suicide prevention for youth ages 10 to 24. So this is a totally free service. It's not billed through main care. It's not duplicative if folks have case management, which I think is a pretty unique piece of the program. And we are allowed to work with families and youth for absolutely as long as they need. We're anticipating, we've got 2 years of funding for this program. We're hoping a renewal of 3 years for a total of at least the foreseeable 5 years for this program. So this is unlike a lot of programs, not just funded for a year and then goes away. We'll be here. And so we really hope that you will reach out. So the program itself is is wonderful in that it's able to be tailored to whatever the needs of the family include. Particularly, we're going to do ongoing risk assessments for suicide or mental health crisis. We're going to be doing safety planning with the youth and with the family. Certainly resource referral, and then as well things like counseling on access to lethal means. So for example, firearms in the home is one of the is the access to lethal means that we'd be looking at. And so this is the one pager that kind of describes the program. And then on the back side of that, the second page is the actual referral form. So just to go over this, pretty much this top part is just who you are, who's referring, and please include a release of information to be able to talk to crisis and counseling. Information about the client name, their legal name, date of birth, and age. Pretty much the only eligibility criteria is that there is a mental health crisis and the youth is age 10 to 24. So it's really broad eligibility. Space for chosen name and pronouns if known, address, referral date, who's going to be the primary contact and their phone number, and then who are the legal guardians. And then just some really basic information, broad brushstrokes about what's going on in that youth's life right now. What are some of the stressors? And then any additional information. So we tried to make this pretty low barrier just to give us some context to then be able to reach out to the family directly or reach out to the referral source. So that's in a nutshell, our Youth Navigator program, where it's just getting started. We're really happy with it and really encourage referrals there.
Tess, I'm so glad that that's in place now. As you know, I've been waiting for it for a long time. So
yes.
Yeah. So if you can
All right.
stop your share. Perfect. Cool. And we also have somebody here who is, or a couple people from the Healthy Communities of the Capital Region. Patricia Buck-Welton, are you going to talk?
I can really quick. Hi, everybody. My name is Patricia Buck-Welton, and I work for Healthy Communities of the Capital Area. I work in substance use prevention, and our grants cover Southern Kennebec County, and we have an additional grant that just came in last year that covers just MSAD 11. Brenda Weiss is on one of our coalitions, and she's been working with us for a long time. And HCCA is your public health community service, and we provide nutrition information. We have a 5210 program that covers nutrition, wellness, and resiliency type trainings. Our Nan Bell is on here with us tonight, and she navigates the wellness teams in all the schools so that kids get information on nutrition and wellness, and staff does as well. My program centers on alcohol and marijuana prevention. So right now, if you can imagine, we are very busy with the new marijuana retail that has just opened in October, which has given us more than ample opportunity to talk to all of our towns. Augusta has not opted in for retail marijuana, but if you have questions around that, please call the office, because what you're seeing for marijuana in Augusta for stores is medical marijuana. And those rules are about to change. Lucky you, SRO Nutter. they're on their way to change again. And so we work in all the schools in Kennebec County. And of course, in the last year and a half, it's been more, you've seen our tobacco prevention person coming in and doing vape prevention presentations, and she actually started doing them in the elementary schools, because our elementary schools are telling us that the kids are seeing them older siblings and actually trying them. So April is now in the elementary schools doing those vape presentations and letting kids know what that's all about, because nicotine is the gateway drug. We are also available to make sure that the community knows of any type of policy changes. And right now, we want you to be aware that with vaping, we are going to be letting everyone be aware that we're trying to get flavors taken out of nicotine. So please be aware of that and get a hold of your legislators. That's going to be a hot topic in the legislature this season. We want those flavors out of those pods because I think once we get those out, they're not going to be so attractive. With alcohol, we're still working with responsible beverages, making sure parents lock up their alcohol, know where it is. That's one of the dangers of COVID right now is these kids are home, and between the marijuana being very available and alcohol, we're seeing substance use pretty abused right now. The other programs that we have is the SNAP Ed nutrition program, and our SNAP Ed educators are in all your schools, making sure that kids know that there are different things that they can be eating for nutrition and how to cook those. Cooking Matters are in all the food pantries and doing cooking classes with low-income folks and making sure that they know a good way to eat and have resources around that. And then we have a very cool program that is farm to school. So we're working with some of the schools to making sure that they get fresh produce right from the farms. And our Alexis Gay worked this summer in a gleaning project, which made sure that the gleaning vegetables got to the school. So we're sort of a roundabout. We have a lot of programs going on. We have two coalitions. One's the Alliance for Substance Use Prevention, which covers all of Southern Kennebec County, and another one that covers just MSAD 11. Like I said before, we'd love to have you at the table. If you're interested, let us know. And the other thing that we have a young man that works with youth on restorative justice projects, as well as the LGBT community, to get them to have confidence to be that voice out into our community. So that is us in a nutshell. We are located in downtown Gardner, and we are in all of your schools, I do believe, doing one program or the other. So let us know if we can be of any of assistance.
Thanks a lot, Patricia. Nice to see you again. Is there anybody else who wants to talk about resources that your organization provides that are helpful, particularly during this pandemic time? Going once, going twice.
Greg, sorry.
Go ahead,
Go
Tess.
ahead, Brenda.
Patty, I do have a question, and I think this, I bring this to the attention of my students, the health survey, the Maine Youth Risk Health Survey, because normally this is the month that we host
Right.
it. And my question to all of us, because we gain so much information from our students, and I was just saying to my students and looking at 2017 and 2019 results with them, will there be, do you know if in the fall we're going to have a remote version or a digital version of this?
That's the plan right now. The state decided to delay that because of the kids being, remote, and we didn't know if we'd get as many responses as we should.
Yeah.
But Brenda, we could also talk about we just did a community survey in Gardner. And what we could do too, in the meantime, is do some focus groups. So if you want to do that, we could certainly work that out with our consultant.
Okay, thank you.
You're welcome, but it should be next fall.
Yep, the Maine Integrated Youth Health Survey is rolling out the first week of October, last I heard.
Sweet,
Yeah.
thank you. We'll get a lot to look at there. Thank you.
Tess, were you going to say something else?
I was just going to clarify just for folks knowing what we're doing during COVID in terms of those assessments through the crisis hotline. We are right now generally doing them via telehealth or over the phone, just so folks do have that understanding as well at this moment in time, but subject to change.
We hope over time. All right. Well, thank you very much. I'm going to just share one last slide or so, and before we leave, and that is, I really want to thank everybody for particularly bringing out your resources, and because we all need to work together. And I want to acknowledge Nami's got, oh, wait a minute. I forgot Crystal, so I'm going to leave this slide up. Crystal, how could I do that? You didn't stop me.
I was trying to unmute myself. Didn't know what you had planned. So I'm Crystal Thiring. I am also from NAMI, and I am glad to be here tonight to be able to hear what's going on in the community and also learn about a couple different resources. Seems like a wonderful group of people here tonight. I am able to report that Principal Silsby was willing to host a youth mental health first aid training. And so we're going to be having that on March 31st. And that's going to be open to staff people, parents, caregivers. I'm going to get that registration link in the chat for you so that you can give it a register. It's a great program. It's something that really helps build confidence in responding in a mental health crisis, or even in situations that haven't hit crisis level yet. I think it's wonderful in the same way that when we take physical first aid, it really helps us feel more prepared in a situation, and we hope to never need it, but having it much better. Also, we have the teen text line, which I will post in the phone number for that again. It's a great resource for our young people. It's open every day from noon until 10 p.m. It's staffed by young folks. They are 23 and under. So it's really folks that know things that those of us on the older side don't in the same way. We also have the NAMI helpline, and I will make sure that number is in the chat as well for folks. I know that we've given you a lot of information tonight, so feel free to give a call over to the helpline, and our lovely person River would be able to direct you as needed. So something I often forget to mention is our support groups are virtual right now. I feel like transportation can be such a barrier for so many things. So I'm going to take that positive piece out of pandemic where I can get it. We have a youth support group that is happening on the first Wednesday of the month from 6:30 to 8. And I will also make sure that that link gets put in the chat for you so you can share that with your young people and see if that's something that would be helpful. There also are some options for adults. I'm not super well versed in them, I will be totally honest, because I live in youth land, but I would recommend scoping it out. And I have been talking with different schools about sources of strength. I'm not going to go into my whole spiel on it tonight, but it is a wonderful program. It's an upstream suicide prevention program that's based in strength, which is just wonderful. It's positive, but none of the overwhelming toxic positivity that we see in some programs. And I would love to connect with Coney folks and explore if that's something that we can bring to your students. It's a great way to maintain connections in such peculiar times that we have right now. So I'm going to make sure that I give a copy over on all these items right now so that folks can explore. And I think that that's quickly all the items that I have. And please feel free to reach out. I love to hear from people, and I like to help problem solve.
So, and a couple things in the chat, Crystal, and you can answer in the chat, but I want, Shelley, you asked about a grief support group for teens and young adults. Boy, I've been talking with a lot of people about the need for grief support and grief support groups for various people in this time. And if there's a need for one that's associated with the school, I have helped some schools partner with bereavement folks to set that up with somebody from the outside and somebody from the school supporting that, so that there's a clinician in the school that the kids already know to make that well. I find that grief support groups for teens or for kids, if they're standalone outside, oftentimes kids are reluctant to go. But think about doing something in the school. And Crystal, somebody also asked about is the sources available for elementary age students as well?
Jenny, thank you for bringing that up. Right now, we have folks available that are able to deliver to middle and high school, and we're actually in process of being able to get certified to bring that to elementary schools to hopefully in fall of 2021. And please feel free to reach out if you'd like to talk about the potential of that at your school, because I think it can be a really big help. And the younger that we start helping our young ones, the better.
All right, so I want to just finish the last slide, and that is something that we have begun to recognize. Elizabeth Kubler-Ross, working with somebody else, added a sixth stage of grief, and we call that finding meaning. I call it post-traumatic growth. And so I'm going to ask you, and I'm going to invite you to put it in the chat. Think about in your own lives and in the lives of your parents and your grandparents, your great-grandparents that have been through incredibly difficult times. Think about what you have learned from that. What growth has come from that? And so I'm going to ask you, I'm going to do the final poll, and that is, what are the unexpected gifts that you have seen from this time? Because through incredible adversity comes also a learning and a focus and a growth. So somewhat to your surprise, this period has brought its own gifts. Check any of them that apply to you. And this cartoon says, I don't know much about Corona, but I know a little bit more about my own family from working at home. All right, so I'm going to end this poll in just a second. I'll let you guys continue to answer a few more. What I hear really often is that opportunity to spend quality time with someone in my life, my family or somebody else. But the most common one here is an opportunity to reorganize or to revamp some aspect of my life, but also learning something new, improve relationships with a few people. A slower pace of life feels good. Do any of you get that feedback from kids in your life? That they appreciate slowing down a little bit? No one expected that, but I hear about that from some kids. Less stress from school, work, or social, particularly those kids for whom school is stressful, those introverts, where the stress comes from social interactions. This is a time where they can thrive. And someone put that in the chat earlier, and I think it's very true. So I think that there is a lot we can learn from this time, as well as beyond enduring. And how do we bring that forward? And how do we invite the youth in our lives and ourselves to find ways of giving back during this time? Because that, particularly, Mainers don't like a free lunch. So how do we give back? Because that's the opportunity, whether it's volunteering for an organization, volunteering for school, helping out with NAMI or the healthy communities. There's lots of ways we can give back. A soup kitchen, particularly in our area, a lot of the soup kitchen volunteers and the food pantry volunteers were older adults who needed to be more careful. And so they were looking for younger volunteers. So this is how you can reach me and Crystal and Amanda, who's the training coordinator in terms of following up with us. And I'm going to stop sharing and ask if there's any other final questions and thoughts. I want to thank once again all the folks for the Augusta School Department who reached out to me and said, hey, Brenda reached in. She's Greg, can you do this for us? And I'm so glad that Kim pulled it together and Tony and Michelle were part of that. Desmond, I really appreciate your being here as well. This is a group effort. And really that's how we get through and cope with COVID. So any final questions or thoughts, feel free to unmute because I'm going to stop talking now. Remember
Brenda, are you and Elijah going to close up?
Yep, I was just unmuting there.
Okay.
So, and I don't know, Eli, do you have anything to say before I? I thank everybody.
Oh, I'm grateful that everybody showed up, and I hope that everyone got something new and something good out of this. And take care, and just always remember that even in the hardest times, people care about you.
Yeah, absolutely. It reminds me that you're on a space shuttle or a space station out there somewhere, Eli. No, I want to thank everybody. Greg, thank you for the support, and all the NAMI folks. And I've gotten to meet Crystal and Amanda, which was really cool. And all the folks that came out tonight. I definitely will go to bed feeling a bit more, I guess, fulfilled and joyful that we've got all these support networks out there to help our kids and help our caregivers and the adults in our community. So thank you again, everybody.
Thank you very much. And remember, we're preaching to the choir, and then the choir gets to sing. So figure out where you put your song in the world, because music is needed right now. And be well.
Thanks, Greg. Take care.
You bet. Take care. Well, that was fun, guys. Thank you very much. Pulling together. Eli, thank you for being here as the one of the more visible students on the call. I appreciate that.
Yeah, I thought it was great. I loved it. Great job. I mean, I'm so excited. Do we all want to shut off the recording right now?
Oh, yeah, we'll probably do that.